So good day, I am Ricardo Eirol. I am your nurse for today. So for today, I am going to execute the proper administering of oral medication. The purpose of administering oral medication is to deliver prescribed drugs or substances through the mouth to be absorbed into the bloodstream, thereby treating medical conditions, alleviating symptoms, preventing disease progression, or promoting the overall health and well-being of the patient. But before doing anything, we should ask first the client later if we should be aware of any cultural sensitivity such as religious belief and personal beliefs, and we will consider that in doing the procedure. Then we will ensure patient privacy is maintained before conducting any procedure to make the patient feel comfortable while doing the procedure. In addition, it is important to remember and adhere to the 10 rights of medication administration to avoid making errors and ensure client safety and well-being. The 10 rights of medication administration includes right medication, right dose, right time, right route, right client education, right documentation, right to refuse, right assessment, and right evaluation. So we must now adhere to the primary measures before doing any types of medical procedure, and that is infection control. Infection control includes hand washing and hand hygiene. There are 5 moments of hand washing, which includes before touching a patient, after touching a patient, before doing a procedure, after doing a procedure, and after being exposed to patient surrounding or any type of bodily fluids. Next is hand hygiene, which is now we will put some alcohol into our hands for us to protect the patient and ourselves from infection and cross contamination. After the infection control, we must now don the personal protective equipment, which includes donning our fresh gown, some mask, some goggles, some surgical cap, and some clean gloves. So let us assume that we are done with donning the personal protective equipment. Now we will organize supplies and bring the requisite to the preparation area. The requisite includes medicine cup, medicine tray, and if needed, some stethoscope and the sphygmomanometer. So now we will unlock the dispensing system. Now we will obtain the appropriate medication by reading the MAR and take the appropriate medication. We will now compare the label of the medication against the order on the MAR or the computer printout. We will now check and note for the expiration date of the medication. We will return expired medication to the pharmacy. We will use only medication that has clear and legible labels. We will now prepare the medication. It is important to calculate medication dosage accurately that is the same with the dosage in the MAR. So double check it. So we will prepare correct amount of medication for required dose without contaminating the medication. We will recheck each prepared drugs and container with the MAR again. So now we will discuss how we will prepare different types of medication such as in tablets or capsules, in liquids, and in oral narcotics. For preparing tablets or capsules, we will place a pack unit dose capsule or tablets directly into the medicine cup. So now we will now get the cap, place it upside down into the countertop, and we will do this in a way that we gently shake the prescribed medicine into the medicine cup, pouring the desired number of capsule. Then we cover it again. If we are using a stock container, we will pour the required number of the medicine into the bottle cup first, then transferring it to the disposable cup. So now we will now get the cap. We will do this like the other. We will now shake, gentle shake the medication until we get the desired number of capsule, and then transfer it now from the bottle cup to the disposable cup. And then close it again or cover it again. So we will now keep narcotics and medication that require specific assessment separate from others, and broke scored tablets only if necessary to obtain correct dosage. For liquid medication, first is we will thoroughly mix the medication before pouring. We will discard any medication that had change of color or turned cloudy. Next is we will remove the cap and place upside down onto the countertop. Upside down, countertop. So now we will hold the bottle so the label was next to the palm and pour the medication away from the label. We will place the medicine cup onto a flat surface at an eye level, and then we will place our thumb to the prescribed level of medication to the medicine cup like this, and then we will fill the medicine cup with the medication. Mhm. Okay. Okay, so now we will wipe the rim of the bottle with a paper towel before cupping the bottle. Discard. Then now we can now cap it. Okay, so if the medication is less than 5 ml, we can prepare the medication in a specially designed oral syringe. We will label the syringe with the name of the medication and the route. So now for the oral narcotics. If agency uses manual recording system for controlled substances, we will check narcotic records per previous drug count and compare it with supply availability. We will remove next available tablet and drop it in a medicine cup. After removing tablet, we will record necessary information on appropriate narcotics control record and sign it. For the oral narcotics, we check every time the numbers of the medication through the narcotics record, since if the number of the narcotic record and the numbers of the medication is not equal, it can be a sign of medication abuse and someone is using medication that is off the record, and we must report that to the agency or to the authorities. So for all medication, we will now place the prepared medication and MAR together on a medication card. We will recheck label on container before returning bottles, box, or envelope to its storage place. Next, also we will avoid leaving prepared medication unattended since it has a high risk of being contaminated or being misplaced if we leave it by itself. And then we will lock the medication cart before entering the client's room. So now we will check the room number against the MAR, especially if the agency does not allow the MAR to be removed from the medication cart. So now that we're inside of the patient's room, we can now start off with the procedure. So good day po, I am Ricardo. I am your nurse for today. So for verification purposes, may I ask your name, your birthday, and your MR number?
My name is Lourd Antiporda, and my birthday is November 6, 2013, and my MI number is 123.
So for confirmation purposes, may I check your wristband? Okay, thank you po. So ano po ba nararamdaman nyo ngayon? Nahirapan daw po yung tumae. Okay, so Miss Xena, I am going to administer some medication po sa inyo and I will discuss it po kung bakit niyo po kailangan itong medication na to. But before anything else, may I ask po if you want some privacy? Hindi na po. Okay. So now, should I be aware of any cultural sensitivity that you have po, like personal belief, religious beliefs, sa religion niyo po ba bawal uminom ng any types of medication? Wala naman po. Okay. So, for today po, before doing anything else, I am going to don a fresh new personal protective equipment such as yung gown, yung mask, yung goggles, yung hair cap, and some gloves. Okay, so may isa mo pong staying sa hospital? Good, bali naman po. So, ipe-prepare ko lang po muna kayo bago kayo uminom ng inyong gamot. So, takot po ba kayo uminom ng gamot?
Minsan,
Minsan. So, okay mag-alala. Pag nainom niyo po agad yung ating gamot is, meron po kayong reward sa akin. Yes. Gusto ko ba malaman yung reward? Mamaya na lang. Okay. So, first is I am going to assist you in a position na maayos po sa inyo. Okay na po bang position nyo? Sitting position? Okay, good. So, bago ko po i-administer yung medication na pinrescribe sa inyo ng inyong doctor, which is Dr. Face, I will take your vital signs po muna as part ng ating assessment bago nyo po i-take yung medication. So, first po is I'm going to check your oxygen saturation using our pulse oximetry. So, kailangan ko lang po inyong finger. Okay. Okay na. Patok nyo lang po dyan. Okay. So, ang lumabas po is 97, which is, okay, good. So, now I'm going to check your temperature naman po. Okay? Sa axillary po or sa medullary. Okay. Pakikip na lang po. So, nilagnat po ba kayo kagabi? Hindi naman. Very good. Okay. So, inyo pong temperature is 35.9, which is in a normal range. So, habang tinitake ko po ang inyong temperature is tinake ko na din po inyong respiratory rate. And inyo po is 16 BPM, which is nasa normal rate naman po ng respiratory, which is good. So, next naman po is I'm going to check your pulse rate. Ano po ba yung check? Okay, so normal naman po yung pulse rate, which is 88. So, good. Next naman po is your BP. I'm going to check your BP. So, ang ating BP ay 100/70. The-document ko lang po lahat ng ating nakuha sa ating assessment. So, after the assessment po is I can now start off with the administering of medication po sa inyo, which is yung lactulose. Since sabi niyo po sa inyong doctor is nahirapan po yung kumain po, no? May constipation po kayo, no? Okay, sa medication na po ito is increase po nito yung water na ina-absorb ng ating intestine and it will soften your stool kaya mas mapapadali po inyong pagtae. Okay, so ang prescribe po ng inyong doctor is 15 ml every 12 hours. So ang last inom nyo daw po sabi sa inyong chart is last 9 p.m. So ngayon is 9 a.m. na po. So I can now administer the medication. So huwag po kayo mag-alala, the whole time na inumin niyo po ito is nasa side niyo lang po ako. And dapat po is maubos natin siya. And pag naubos natin siya, meron po kayong surprise sa akin. Are you excited about that? Excited ka po, very good. So, liquid medication po siya, isang inuman lang po. May nakaantabay tayong water and juice. If kailangan niyo po ng water and some juice. Ito po ang ating juice. Ating juice. So, ready na po ba uminom? Okay, teka. Isang lagukan lang po yan. Kaya yan. Ready ko na po ang water and yung juice. Kung alimang gusto. Okay, go. Okay, very good. O, itong panulak na tubig. Okay. So, nag-prescribe din po si Dr. Face ng vitamins po sa inyo para magkaroon din daw po ng at least vitamins ang ating katawan at ang stomach para mag-function ng maayos din po siya. So, ito naman po is isa po siyang capsule. So, mabilis na naman po siya. Meron naman po nakaantabay na tubig para itulak po ito. So, ito po. Nakaantabay po ating tubig. Okay. Tubig. Okay, very good. Dahil dyan, meron kang ice cream. Okay, very good. So, since ang kailangan nyo pong dosage every day is 2, so mamaya po ulit ang ating pag-inom, which is 9 a.m. today, mamaya po ulit 9 p.m. And we will monitor if after ng pag-inom natin ng medication is kain na po tayo, nakapaglabas ng stool. Update nyo lang po ang mga nurses if merong changes sa inyong if may constipation pa rin. Okay? So, tapos na po tayo with the administering ng oral medication. So, may monitor pa rin po namin ng inyong progress. And so, now naman po is I'm going to discuss the holistic nursing care, which involves not only your physical aspect, but also the emotional, social, psychological, and physical aspect niyo po na hindi lang po kami nakafocus para pagalingin ng inyong physical or mag-take care ng inyong physical, but also by taking care of your spiritual, social, psychological, and emotional well-being. So, thank you po. So now that we're done with the administering of the oral medication, we will now dispose all supplies appropriately, especially the personal protective equipment. We will dispose this in the appropriate bin. We will discard the used disposable supplies and those na pwede pa pong gamitin, such as yung ating medicine tray. We will put this para ipalinis po. So we will now document all pertinent information that is important or pertinent in our nursing chart.
This time naman po, we will replenish the stock. And return cart to appropriate place.